Hello everyone, I am Aparna. I am an optometrist. I am doing my fellowship in Pediatric Optometry under the Indian Academy of Optometry. Today we are going to see about the vision therapy. What is the vision therapy? The vision therapy is a program that aims to treat the visual abilities such as strabismus, amblyopia, etc. by doing some exercises and some therapies. Today we are going to see about the 5 vision therapies. The 5 vision therapies are the pencil push-up test, the computer vision software, the prisms and lens fixations, the patching, that is the occlusion therapy, and the synaptophore. In first, we are going to see about the pencil push-up test. The pencil push-up test is a convergence insufficiency exercise. For the pencil push-up test, we need a pencil or any other objects that is in the shape of the pencil. In that, we should have some characters, like it may be like a letters or symbols or animals or anything else. But we need a characters which will stimulate the accommodative system. Okay, I will demonstrate how to do the pencil push-up test. And in pencil push-up test, we need a single clear image, not a blurry double image. Okay. First, we have to instruct the children to keep pen at an arm length, to outstretch their arm and keep the pen in the arm length. We have to ask the children to focus on the characters. Focus on these characters. We have to focus on these characters. From the far, we have to move this pen towards the close. Until then, we have to focus on the letters one. From far, we have to move the pen towards close. When we see double or blurry image, we have to relax our eye and we have to see it as a single image. We have to try to see it as a single image. If we can't, if the children can't see it as a single image, we have to repeat the test again. We have to repeat the test again. This test can be done to 1 minute or approximately 12 cycles per day. After doing the test, you can relax your eyes by seeing to the distance object. The next vision therapy is the computer vision therapy software. The computer vision therapy software is very much advanced. It can be used in the home or office itself under the guidance of the parents or the guardians. Today we are going to see about the one type of the computer vision therapy, which is the perceptual visual tracking. In the perceptual visual tracking, we have five types of procedures. The matching the targets, moving the line, moving lines, and moving box, hidden targets, and saccadic tracking. Now we are going to see about the third vision therapy, that is the prisms and the lens fixation. In the prisms and the lens fixation, the prism is very much effective in order to relieving the children from the diplopia and the astenopic problems. But those children who have already undergone the refractive cataract or strabismic surgery, who are very unhappy to wear the specs again with the prisms, in those cases we may dispense the contact lenses with a small amount of vertical prisms. It is available. And in those cases, such as some non-strabismus cases such as the divergence, insufficiency, basic esophoria and vertical heterophoria, the prism is very much effective. But in those cases such as the convergence insufficiency, convergence excess and divergence excess and basic exophoria, in those cases the prism is not that much effective and we have to use other modalities of vision therapies and lenses in it. So now we are going to see about the fourth vision therapy, that is the occlusion therapy. It is a passive treatment used to treat for the amblyopic children. It is very effective under the age of 8 to 9 years. There are some types of the occlusion therapy. They are the total partial occlusion therapy, conventional inverse occlusion therapy, and full-time or part-time occlusion therapy. So what is the conventional occlusion therapy? In that we are going to patch the normal eye of the children and forcing them to use the amblyopic eye for their routine work like drawing, coloring, and making them and encouraging them to do some works using this amblyopic eye to make the eye work. In inverse occlusion therapy, we will patch the amblyopic eye when the normal eye has an eccentric fixation. Full-time occlusion therapy. In full-time occlusion therapy, the child will have patching throughout the full time of the waking hours, but it may lead to occlusion, amblyopia or induced strabismus. In such cases, the part-time occlusion therapy is used. Part-time occlusion of the one eye and part-time occlusion of the other. The total or the partial occlusion therapy. In total occlusion therapy, the entire lights entering into the eyes are occluded, so that we may, in nystagmus cases, it may induce the nystagmus more. In such cases, we will use the partial occlusion therapy, in which the one eye is used to blur with the positive lenses or atropine. Now we are going to see about the synaptophore. It is also called as the major amblyoscope. It plays an important role in the exercises of the amblyopia, suppressions, divergence, convergence, and ARC, that is the abnormal retinal correspondence. And it also useful for the estimation of the grades of the binocular vision. Okay. Now we are going to see about the instrument. This instrument has two tubes in which we place the slides, and it is a right angle bent or upon a base. We also have a mirror that reflects the images towards the eyepiece. The eyepiece is about plus 6.5 diopters, through which the children will see the image. For the convergence exercise, we have to move the two tubes converging using the knob. By making the two tubes converging, the eyepiece towards the eyepiece where the children will see may converge their eyes. And also we can do the divergence exercise by diverging the tubes by using these knobs. This is the synaptopore. So these are all the 5 vision therapies used for the pediatric children and are very effective. Thank you.